The number of deaths in the United Kingdom have reached 578. It's an increase of 113, which I think is one of the biggest increases, one of the biggest daily increases so far. Let's go to Katie Spencer, who is in the Sky newsroom. And Katie, a sizable increase in the number of deaths in the UK.
Sizable increase, as you say. These figures have just come through in the last few minutes. 578 deaths in the UK, 11,658 people testing positive within the UK for COVID-19. And actually, within the last few hours, the worldwide picture of the number of positive cases have come through, and that now has exceeded 500,000 people testing positive for COVID-19. Tests is something that has been spoken about a lot today. We know that Public Health England has given us a bit more detailed information about what the situation is with regards to testing for COVID-19 here in the UK. Professor Yvonne Doyle was speaking a little earlier today at the Health and Social Care Committee. They had a remote sitting with various experts dialing in to give their evidence so that it could be heard in front of MPs. And she was asked by the chair, Jeremy Hunt, why is it that the UK seems to be lagging behind countries like Germany, countries like South Korea in terms of people that are being tested. She acknowledged that Public Health England does say that it needs to increase the number of tests that we are doing in this country, but she said part of the reason that there has been a bit of a delay is down to the fact that it is a lot of competition at the moment to try to get hold of the material and the equipment to try to make these tests in the first place. But she did say that these tests are coming. Have a listen.
By the end of March, the 30th of March, we expect to have capacity for nearly 12,000 tests a day. And by the middle of April, possibly a little later, we will be moving to 15,000 and 25,000 by that date, by the middle to the end of April. And then behind that, there is a plan, and we'll have heard it proceed on the media, for 1 million tests, which people can do themselves, on 1 million tests for members of the public. In other words, they will be able to take a blood test and send it back in the post and get that analysed. That is an antibody test, which tells you whether you've had the condition.
Another big talking point today has been the lack of personal protective equipment for NHS workers on the front line. And actually in this same committee hearing, the British Medical Association went into some detail about the pressures, the stresses that many of its members are under at the moment, feeling like they don't have the equipment they need. And it says that actually the advice it's received is that GPs and community nurses, if they want some of this protective equipment, it's been advised that actually they should consider buying it themselves. One bit of good news that we are hearing in the last hour as well that we should say, we know that call went out for volunteers to help with the NHS in any way that they might need in the coming weeks. A phenomenal response that they have received. More than 660,000 people now have signed up to that scheme offering to help.
And just, I mean, on trends on the UK deaths, very difficult, isn't it? Yesterday, some people drawing optimism from the fact that I think it was 28 deaths, now 113, very sizable today.
Yeah, I mean, these are figures that are changing every day, and it's something that is hard to draw too much into, because we know that we have been warned that in the coming weeks these figures will be rising. But certainly it is a substantial increase. 578 deaths, 11,658 people testing positive within the UK.